Hey, this is Greg from Big Bay Mornings back with board-certified plastic surgeon, Dr. Bay. What's up, Dr. Bay?
I'm great, Greg. How you doing?
I am amazing.
Well, you're looking a little bit like I wasn't sure if I was with the Terminator or with Greg. What's up with the sunglasses?
I'll be back. Listen, Dr. Bay, I had a late night last night, and I've got a little problem. I usually don't have such deep bags under my eyes if I get a lot of rest. I do know that that is a problem for a lot of people. No matter how much sleep they get, they
Right.
still have bags under their eyes. No matter how much concealer or lotion. Is there something you can do about that?
Yeah, I mean, you can get deep bags under your eyes. Possibly that could be genetic. It could be staying up late, drinking, or at a library
Did you
reading,
say
like
drinking?
you probably were doing.
Did you say
Well,
drinking?
you were. I did say drinking, but you were probably at the library reading the latest Emily Bronte books.
I was drinking at the library.
Or Jane? Is it Jane Eyre or Emily Bronte?
Jane Eyre.
Which one?
Yes, Jane
Jane
Eyre.
Eyre. Okay. Anyway, so yes, you can get those deep bags under your eyes. Again, it can be genetic. If you look at your parents and they have it, then you're probably going to have it too. So yes, concealer is the easiest thing to do. But a lot of people mistake that the dark circles under the eyes are because of just like capillaries and things like that. And it's really not that. What it is that the areas under the eyes, they can kind of get deep and sunken in and in the shadow of the eye. So one of the ways to treat that is to bring that out from under the shadow of the eye by injecting fillers and things. So you might be thinking, well, they're puffy. Is that really going to work? So there's two things going on there: sunkenness and puffiness. And you can treat both of them with fillers initially, at least non-surgically. So with the fillers, you can just bring out that sunken area out from under the shadow in the eyes, and it'll look a little bit brighter, not as dark. And that's one way of doing it. But the puffiness, that's when you have the puffiness on the lower lid, and then you have this deep crease, which is called a tear trough, and then you have your cheek. And so what happens is as people get older, that the fat bags are always there, but the difference is that your cheeks are higher up on your face, and as the cheeks descend and they sink, you start to uncover that deep crease, and then you start to see those bags of fat. So you can treat that with fillers, but all you're really doing is camouflaging it. You're just basically filling in filler in that tear trough area, that deep crease, so there's a smoother transition from the puffiness of the eyes down to the cheek. So you're using the filler to kind of fill in that gulf, so it's a smoother transition. So that's the non-surgical treatment is fillers. It does really work. But if you're looking to get something more surgical done, then as far as the puffiness under the eyes, that's all made from fat. So you can go on the inside of the lower eyelids, pluck out that fat to take down the puffiness, but then you'll actually take some of that fat and you can fill in the tear trough, that deep crease, to help smooth that transition to the cheek. So
It's
lots
like
of
with
things to
other
do.
parts of the body. You can suck out fat maybe in your stomach and put it in your butt. You can take the fat out of here and put it here and kind of fix everything.
Exactly right. And the other thing we do is you can, aside from taking the fat from under the eyes and putting it in that tear trough to fill that in, you can also take fat from other parts of your body to fill in the cheekbones, to fill in the nasolabial grooves or these parentheses lines. And typically people are coming into the office and we're just doing regular fillers like Radiesse or Juvederm or Restylane, things people have heard of. Those are just off the shelf. We can fill in these lines. We can build up the cheekbone with Juvederm Voluma or Radiesse, and you can still do that. But if somebody's already going to the operating room to get something done with their eyelids, then instead of them, it just seems silly to have an operation and then get discharged and then come back a couple weeks later and then get fillers right here. I mean, like,
Yeah,
why
do it all at
wouldn't you
once.
just do the fat,
Yeah.
do it all at once, get all that good fat? And it's also less expensive when you take it because you get voluminous amounts of fat as opposed to one syringe here or one syringe there. You get a lot of fat. You can fill this in, you can fill this in, you can fill in the jawline, you can fill in the temples. I mean, fat is great. Might as well use it. We've all got it. And if you're already asleep for another procedure, then utilize it then as opposed to coming back repeatedly for fillers, because the fat does last longer. Some of it does die, no question about it. And we always tell people after about 6 months, 50% of the fat dies, but whatever's left over after 6 months stays for good. So
That-
long
that's
answer,
awesome.
but
That-
that's the right answer.
That's awesome. So tell people how they can get a consultation at your office.
Yeah, so if you feel like you've got puffy eyes or deep creases, like I said, called the tear trough, or you don't feel like you have enough cheekbone fullness here, then we can, or the other thing is we'll talk about another time, but if you have too much fullness here in the like fat, that's the buccal lipectomy we can do. We can do that chubby cheek treatment. But either way, you can come in for a consultation. You can book a consultation at realdrbay.com/contact, REALDRBAE, not BAY. And before you schedule that consult, whether it's virtual or in person, we definitely want you checking pricing. Go to our website, realdrbay.com/pricing, and you can see all the cost involved with all these procedures, no hidden cost. You can check out our chat bot on the homepage, which will give you pricing. So we want everybody coming in fully informed for their procedure.
Awesome. Thanks, Dr. Bay. Great to see you again.
Always. Thanks for joining me.